So in diagnostics and triage, I think the real reason why this is the huge cost area is because anytime a patient is making their way through the healthcare system, one, they're probably not using information services as well as they can, right? So a lot of the time, I'm sure anyone else who lives in the UK, you call your GP surgery and they say, you want to book an appointment with a doctor, but maybe you don't need to see a doctor. Maybe you need to see a pharmacist, or you need to see a clinician, or you need to see someone else. And so a lot of the time we're still going through that process manually. We're going to see the doctor, then we find out we can see someone else, and then we go see someone else, or you go have to see the GP 3 times before you find a referral to the right specialist, or you feel like, oh, something's wrong, and you immediately go into the emergency room when really that could have been dealt with at the GP's office. And it's really about getting that information out there. And what you can tell from this graph is, if you're looking at the improved triage, the cost savings that materialize from a reduction in appointments during COVID-19 can probably be replicated with the use of better triage. So just to give you an idea, one of the data points that we found when we were doing our research here, there's a company called DrLink in the UK, which provides solutions for AI-enabled triage and better triage in hospitals. And they estimate that out of the 25 million hospital A&E attendances that occurred in 2019, 4 million of those could have been avoided through better triage. And that cost of those 4 million attendances is about £600 million. So that gives you an idea of kind of how we're coming to these cost savings, and the magnitude of number of appointments that could be avoided in emergency rooms through improved triage. In diagnostics, there's sort of, it's not just sort of in the pre-care section, but it's also afterwards. So for instance, this is more in hospital. If you're having a number of scans, there's a lot of stuff coming through in the radiology departments about ability to use machine learning to assess the scans more quickly and support radiologists in their work to get through more quickly. And there are other things coming out. So for instance, you could get asynchronous care through referrals, where you might be in your GP's office and you need some kind of referral to a dermatologist, and there may be someone who you can get an immediate referral to. You sort of send in a picture and they give a feedback immediately saying, yes, you need to come in and see the specialist, or no, you don't need to. You can just deal with this quickly in XYZ fashion. So there are a few different angles that are coming through to impact on this. And I think just one more point that I will add here that I have in the key triggers is, the triggers that we see in terms of adoption of diagnostics and triage services is, one, greater patient familiarity with digital tools. I think that all of us this year have become more familiar with the digital tools that are available so far. So I think that, one of the numbers that I've seen is that there's an NHS app where you can see some of your personal health record. You can see your prescription histories. And not all GPs are linked to it, but a lot of GP practices are. And the number of users doubled to 1.5 million, I think, or the number of downloads of the app doubled to 1.5 million just in the first month of COVID kicking off. So that, a lot more people are using these apps. And I think particularly in areas like triage, where hospitals are facing a huge backlog of patients from the ones that they haven't seen during COVID, they're going to be under a really big pressure to figure out how they're going to manage that backlog, and how they're going to manage the patients that are going to come through when we get to the other side of this pandemic. So I think there's going to be a big demand here for this type of solution.